Sunrise. We're now in our weekly health alert segment. And for today's Man's World, we're talking about low sperm count. Oftentimes, men do not realize they have this issue until they are ready to have a family. But what can we learn about it beforehand? Here to tell us more and how to understand it is Dr. Orlando Thomas. Welcome to Sunrise, Dr. Thomas. How are you?
I'm doing great. How are you?
We are wonderful. All right, so let's talk a little bit about this, because there are many men, particularly younger men, who really don't pay attention to low sperm count, and so can we take a closer look at why many men may have a low sperm count, and why should they should pay close attention to these things?
Yeah, it's actually quite common. Many men have this aura of invincibility and think that nothing can ever be wrong with them. But in fact, about 1/3 of couples have difficulty having children, and many times, half the times, it may be a man with a low sperm count. So first, let's define it. A low sperm count is defined by actually checking the sperms, the volume, and specifically the number of sperms in each mil. And if it's below 15 million, which is a large number, it's considered to be low, and men may have difficulty getting a woman pregnant. Causes are various. They may include hormonal causes, very commonly, and may have a low amount of testosterone. In the physical causes, just damage to the testes from injury or being in a too hot of environment where you work. It might be due to infections like chlamydia and gonorrhea that men have had in the past and weren't treated appropriately for it. Can be due to prostate issues and damage to different tubes that carry the sperms from the testes where it is expelled. So there are a whole host of causes.
But you know what I want you to address, though, doctor, the whole issue of obesity, for example, and many men don't understand that obesity is a risk factor, just as though you've listed the other risk factors.
Yes, obesity does contribute to changes in a man's hormonal level. So obesity causes men to have low testosterone because the estrogen is preferentially made, and that's a hormone that will drop your sperm count. Testosterone is what you need to build it up. So a lot of men who have excess weight, especially fat on their body, especially around the midsection, this is a big cause of infertility and low sperm count specifically. Smoking does cause it, and there are other issues with the testes, but obesity is a big concern.
So, Doc, what if your ejaculation is a lot? So you're blaming the lack of having a child on the female rather, because you're saying, you drink up your juice and you take your strong back, and it's a lot. What happened? What's the solution for that, or the answer to that?
All right, so the ejaculate, the volume of fluid that you see is not what determines your sperm count. The fluid that comes out is a combination of sperms, fluid from the prostate, and fluid from the seminal vesicle. And the bulk of it is actually prostatic fluid, which contains no sperm. The sperms are cells within that fluid, and a man may ejaculate copious amounts of fluid, but when you check it, there are no sperms. They call that azoospermia, or low sperm count, or oligospermia. So it's like corn in some soup. It could be a small amount or a large amount, despite the amount of soup you have. So the volume is not what determines it. You have to get the sperm count checked, and many men don't.
Doctor, I want to go back to the risk factors and talk a little bit about testosterone boosters and vitamins and how those can affect the situation.
Yeah, so as I said, testosterone being low can affect the sperm count, and this occurs naturally as men get older, but can occur for a number of different reasons. So if we find that your testosterone is low, then we would do things to build it up. We could give you testosterone injections, but there are a lot of testosterone boosters that exist naturally. There's an herb called maca, South American tuber from the Andes Mountains. Very good, and we have it available in Jamaica in tablets. There's also ashwagandha, Ayurvedic herb from India, which has been shown to boost sperm count by boosting your testosterone levels. Zinc supplements and vitamin C supplements both directly and indirectly boost sperm count also. So having these nutrients in adequate amount, especially if you're low in zinc, to take it is life-changing for men with low sperm count.
Yes. Are there really signs?
And also,
okay. Go ahead, doctor.
I'm saying also having a healthy diet generally, because for your body to make sperms, you need adequate amounts of fluid, adequate amounts of good quality protein, lots of other nutrients. So your diet overall must be one that favors health. We've found that large amounts of trans fats, for example, that you find in fast food, lowers your sperm count.
Yes.
So you should have a healthy diet with lots of fruits and vegetables and nuts, especially your nuts. Brazil nuts and pistachios have high amounts of zinc, which help your prostate.
Yes. Are there really signs that men should look out for, or does it doesn't happen until it's time for them to have a family, infertility? But does it really mean that it is impossible to have children if your sperm count is low? So let's talk about the signs that, men should pay attention to.
Well, first of all, it's not impossible to have children low sperm count. It is harder.
Yes.
There are no specific signs for low sperm count, but there are signs for the risk factors.
All right.
So if you're overweight, as we said, if you have a job that requires you to sit for long hours in a hot environment, such as you're a truck driver, you smoke, you've had recurrent STDs, you have pain in the testicular area, or you have a swelling in the testicular area, which may be like a varicocele, if you have low abdominal pain and urinary symptoms, these are signs that you may have something wrong with the sperm making and sperm delivery equipment, the testes and the tubes and prostate specifically.
Yes.
These are things that men should be aware of. But if you have been trying with your partner for over a year and you haven't gotten her pregnant, it suggests that something is wrong with either the man or woman. And there are many men who have been with 3-4 partners over many years and have no children. Then you really should start suspecting something is wrong.
Right.
Is it reversible? Is low sperm count reversible?
Certainly. The causes that are many. Yeah, sure. So I do what we call functional medicine, and in functional medicine, we believe that once you identify the underlying cause of a problem and you deal with the cause many times, the condition is reversible. So yes, with supplementation, if the man is low on certain kind of nutrients, that helps a lot. If you're low on testosterone and we supplement you or give you testosterone, sperm count certainly comes up. We have lots of herbs and natural substances that have been shown to increase sperm count by over 100%. Ashwagandha, for example, I mentioned, have been shown to increase sperm count by 150%. So I have many success stories of patients who have had low sperm count and we have helped them bring it up and they have babies to show for it. So this is something that's completely treatable. And in some cases where the sperm count is just not moving because the man might have a genetic problem, they're born with a low sperm count like Klinefelter syndrome, and we may have to use artificial means to help him to get a baby.
Right. Let's talk a little bit about diagnosing the problem. How is that done, doctor?
Diagnosis of oligospermia or low sperm count is via a semen analysis. So men would have to literally pass semen into a cup, and we analyze in the laboratory, analyze the semen for the number of sperm using a microscope, analyze it for the quality of sperm, analyze it for how active or motile the sperms are, and analyze the sperm for infections and other cells that might not be helpful in the semen. So it's a microscopic examination in the lab of sperm. You would have passed in a cup within a specific period of time.
Yes.
You have to pass within a half an hour of being examined.
How important is one's medical history with regards to the diagnosis?
Well, the body functions as a whole. And so if a man has underlying illnesses such as prostate problems, diabetes, if he has poor blood flow from atherosclerosis, high cholesterol, all of these things can affect his ability to make sperm and deliver sperm. Certainly, as I said, a man is having low testosterone, and that can be due to also stress. Stress is a big cause of low testosterone. So a man's lifestyle and his medical history does impact his sperm count. And it will help a doctor and guide a doctor to say, okay, these might be possible reasons. Because sometimes it's easy, but sometimes difficult to figure out the cause. Once we find the cause, then we can begin to treat.
Let's talk about treatment. That's the operative word right there.
Okay, so treatment is geared at the specific cause. So if, for example, a man has a varicocele or something is wrong with the scrotum specifically, then we can operate to fix that problem. If there is an infection causing a blockage to a tube, if we catch it early enough, we can treat that infection and prevent the sperm from being locked up in the testes. Many times when we find the infection, it's way too late, and operations can be considered, or may do artificial methods to extract the sperm. If a man has low nutrient levels, such as low zinc or low testosterone, we have supplements we can give for those. And there are pharmaceutical drugs that can boost testosterone in men who have low testosterone too, such as Proviron and a few others. We also could treat prostate issues that men have. So treating a prostate problem will help his sperm quality, not necessarily quantity, to go up, and that might increase his chance of having a child. But the treatment varies based on what the problem is. It could be surgical, medical, pharmaceutical, or dietary. And certainly weight loss, done especially through resistant exercise. Resistant exercise is my favorite way to boost testosterone. So men lift weights, do your push-ups, do your sit-ups. This is your guaranteed easy fix to a low testosterone level. It works, it works, it works. The more you move, the more the testosterone goes up.
All right. Thank you so much, Doctor, for sharing that information. We appreciate it. Have a great day and all the best.